Thank you, Laskin Corlow. But I welcome the opportunity to contribute to this debate, and I could congratulate Deputy Brown for his tireless efforts in advocating on behalf of patients and families of people who suffer with mental health. Not only has he repeatedly pointed out the failures on the part of government, he has been to the fore in bringing forward solutions. And the bill last year, which ensures in future a greater emphasis will be placed on the autonomy of individuals rather than relying on the principle of best practice as set out in the 2001 Act. But the recent report from the Mental Health Commission is very worrying, and it highlights huge deficits within mental health services, including issues of seclusion and physical restraint of young people. Last year, 84 children and teenagers were admitted to adult units. That is an appalling figure by any stretch of the imagination. And last week, during a debate in the Council of Europe, where there was a specific debate on ending coercion in mental health, the need for a human rights approach, the Commissioner for Human Rights said, coercion-based mental health system perpetuates the isolation of the very persons who need the support of their community the most, which in turn fuels more stigma and irrational fear. The rapporteur of the report points to the fact that there is not enough scientific evidence to prove the usefulness of coercion in reducing harm, whereas there is abundant evidence for the harm and sometimes the irreparable harm that involuntary placement and treatment can cause for patients. We need to reduce the stigma and the barriers around the provision of mental health care so that persons are empowered to seek and fully participate in their treatment as early as possible. And the staffing levels remains a serious concern, and when you have services in some parts of the country having fewer than half the recommended number of staff required for child and adolescent mental health services as set out in a Vision for Change, this is simply not good enough. Waiting lists of over 300 people waiting a year or more for access to mental health services. We are failing, and the government is failing this sector of society, the most vulnerable people in society. You are failing abysmally. And I want to acknowledge the good work that so many community groups like Good to Talk in Mullingar and other groups. Were it not for the work of those groups, these lists would be far higher. And I think it's high time that we accelerate our recruitment and work towards full implementation for the Vision for Change, because if we don't, the long-term consequences of that are going to be, as the Commissioner for Human Rights in the Council of Europe said last week, we're going to cause irreparable damage. Gurmagad Laskin Corlow.